Welcome to the Canada News. I am Divya Rai, and now top stories of the day. Brampton West MP Kamal Khera questioned how the procurement minister clean-up vaccination process was going on in Canada, saying it was being misleading by the opponents. Brampton West MPP Amarjot Sandhu spoke on the Sikh Heritage Month, saying April is very important for all Canadians because this month is a festival of all religions. Neena Changri MPP from the Mississauga Streets Valley talked about the COVID effect in the Peel region, which she described as a difficult time. The biggest story of the day today. Brampton West MP Kamal Khera questioned how the procurement minister clean-up vaccination process was going on in Canada, saying it was being misleading by the opponents. Responding, Procurement Minister Anita Anand said 31% of the Canadians had received the first dose, and by September, all Canadians will be vaccinated. It informed that Canada has agreement with the Pfizer. Canada will receive 35 million doses in 2022 and 30 million doses in 2023.
Well, member for Brampton West.
Mr. Speaker, Brampton is one of the hardest hit communities by this pandemic. We've been a COVID hotspot with the highest test positivity rate in Ontario, where 1 in 5 people are testing positive. I've heard many questions from my constituents about vaccine supply, how many doses have arrived into Canada, and when will they get their vaccines. These are important questions. Unfortunately, the facts often get lost in misleading and partisan spins from the opposition. Can the minister please set the record straight, provide clarity on our procurement plan from day one and into the future? Thank you.
The Honourable Minister.
Mr. Speaker, I thank the honourable member for her question and want to assure the House and all Canadians that we are managing the vaccine supply chain in an incredibly competitive environment, leading to us already procuring 14.7 million doses received in Canada. 31% of Canadians have received at least one dose, and we are third in the G20. In fact, the provinces are so confident in our supply that both Ontario and Quebec have announced that they will start booking vaccine appointments for all adults before the end of May. Before the end of June, we will have 48 to 50 million vaccines in this country, and before the end of the summer, all Canadians will be fully vaccinated who want it. It is true. We have been here for Canadians at every step, and I'm privileged to share that Canada is once again one of the first countries to sign an agreement for COVID-19 vaccines with a blue-chip supplier like Pfizer. 35 million doses in 2022, 30 million doses in 2023. We will also be receiving 2 million doses a week in May, 2.5 million doses in June, for a total of 48 million by the end of June. To those who suggested vaccines wouldn't arrive till 2030, that we weren't thinking of the future, that we had no plan, we do have a plan, and it's working, Mr. Speaker.
Brampton West MPP Amarjot Sandhu spoke on Sikh Heritage Month, saying April is very important for all Canadians because this month is a festival of all religions. This month is celebrated by the Sikh community as Khalsa Sachna Divas. Sandhu said that Sikhism has also given a message not to discriminate against anyone on the basis of caste, color and religion.
Thank you, Speaker. It is an honor to speak on Sikh heritage in the auspicious month of April when we celebrate the birthday of Khalsa. This gives us the chance to know about the glorious history and the significant role the Sikh community has played in Canada, and a great opportunity for us to become even more of a proud multicultural country. Canada is a diverse land filled with diverse cultures, diverse traditions and festivals. Multiculturalism is the value every Canadian stands by. The month of April is special for Sikhs, Christians, Hindus and Muslims, as members of different faiths are celebrating several festivals in Canada and around the world, including those festivals that are celebrated in different states, predominantly in India, like Vaisakhi, Vishu, Easter, Yugadi, Ramadan, Chaitra Navratri, Varusha Parupu, Gudi Padwa, Cheti Chand, Navre, Sajibu Chirioba, Bihu, Navvarsha in Nepal and more. It is this diversity that makes us so distinct and rich, and we must see this as an opportunity to enrich ourselves, to fight against stereotypes and to unite more and more every day. As a faith rooted in love, this is what Sikhism stands for, upholding the equality of women and men and denouncing any discrimination of gender, race, caste, creed or color. Happy Sikh Heritage Month. Thank you, Madam Speaker.
Neena Tangri, MPP from the Mississauga Streets Valley, talked about the COVID effect in the Peel region, which she described as a difficult time. She said frontline workers and multi-generation families and new Canadians live in the Peel region, but the number of hospital COVID patients is very high at the moment. Tangri said that although the Premier had asked the federal government to increase the Canada Recovery Sickness Program, the government has since introduced a 200 daily paid sick leave program for 3 days. According to Tangri, this is important to keep the province workers safe.
Today I would like to talk a little about my riding of Mississauga-Streetsville and the region of Peel. As we all know, the situation related to COVID is extremely difficult for everyone across Peel, Ontario and around the world. When it comes to making decisions which affect all Ontarians, balancing health and safety with sustaining our businesses, rolling out our vaccines, prioritising communities and people within those communities, well, it is critical that we take all possibilities into consideration. A large number of essential workers, multi-generational families and many newcomers to Canada call Mississauga and the region of Peel home. We have a very vibrant, caring and hard-working community. However, COVID has taken its toll on all of us. Premier Ford's push to secure our borders and limit flights into Ontario has taken too long by the federal government, allowing not just the original COVID to enter Ontario, but now we have the variants of concern raging through, affecting those of all ages. Hospital ICUs are filling up with younger people, some of who are on ventilators and, unfortunately, some who do not make it. Speaker, the Premier also pushed the federal government to enhance the Canada Recovery Sickness Benefit. Well, Minister of Labour announced a programme for paid sick leave. If passed, it will reimburse the employer for up to $200 per day for up to 3 days per employee. This allows those who do not feel well or need time to take care of a loved one the opportunity to stay home. I ask that all members of this House support our government on this initiative so that we can implement paid sick days as soon as possible. Thank you, Speaker.
Ontario Health Minister Christine Elliott claims safety of the province is the main goal of the government. 5 billion doses administered by the government and 4.6 million Ontarians have received the dose. Starting with long-term care homes, he said, adding that the government's next goal is to vaccinate as many people as possible in the hotspots. According to the Health Minister, from April 30, all people above the age of 55 will be eligible for vaccination.
The health and well-being of Ontarians remains our top priority, and the province's vaccine rollout is a cornerstone of our fight against the third wave of COVID-19. Despite an unstable and unreliable vaccine supply to date, we have continued to build a solid foundation in our rollout. As of yesterday, we have administered more than 5 million doses, with over 4.6 million Ontarians having received at least one dose, starting with the province's most vulnerable populations, including long-term care residents. I'd like to thank all our frontline healthcare workers, the public health units, and many other partners whose hard work has helped us come this far. Beginning next week, Ontarians will begin receiving a more predictable and increased supply of vaccines from the federal government. This will allow the province and our partners to further accelerate our vaccine rollout and get more shots into arms. This includes a focus on getting vaccines to those most at risk. To that end, the province will increase the supply of COVID-19 vaccines to hotspot communities by over 1 million doses. During the weeks of May 3rd and May 10th, 50% of upcoming vaccine shipments will be dedicated to hotspot communities, administering doses through mobile teams, pop-up clinics, mass immunization clinics, hospitals, primary care, and pharmacies. This targeted, time-limited approach is designed to reduce COVID-19 cases, hospitalizations, and deaths in our most at-risk communities. At the same time, an increased supply of vaccines mean we will not be taking away vaccines from other public health regions. Their allocations will remain the same as previously planned and will increase later in May. More predictable supply from the federal government also allows the province to provide more certainty in its vaccine rollout and when Ontarians can expect to receive the vaccine. To that end, as of April 30th at 8 a.m., individuals aged 55 and over across the province will now be eligible to book their appointment through our provincial booking system.
Head of the Ontario Vaccine Distribution highlights key aspects of vaccination distribution in Ontario. He said that the supply of vaccines in the province was being increased to ensure smooth running of vaccine rollout process. He also said that 16 pharmacies have been set up in the hotspots area.
Today is very encouraging to be able to state that Ontario is responding to an increase in vaccine supply by ramping up its rollout of COVID-19 vaccines in at-risk communities. In addition to the enhancement just mentioned by Minister Elliott, 16 select pharmacy locations in hotspot communities in Toronto and Peel will begin administering the Pfizer vaccine to individuals aged 55 and above. This will continue to expand to a broader base of communities later in May as supply allows. Currently, pharmacies that are participating in the vaccine rollout across the province are administering the AstraZeneca vaccine to individuals aged 40 and over, and that will continue. As our immunization rollout continues across Ontario, we are determined to get vaccines distributed to as many people as possible in areas where COVID-19 and its variants are spreading most rapidly. That is why, together with our local public health partners, we are using all available vaccine channels to make it as easy as possible for people to get a vaccination. Along with pharmacies, large-scale community clinics, healthcare providers, as well as mobile and pop-up clinics, the addition of employer-operated workplace clinics in hotspot communities announced last week is an impactful step in the expansion of our vaccine rollout. Employers such as Amazon, Maple Lodge, and Maple Leaf Foods are contributing to our collective efforts by protecting their employees as well as setting up local clinics so residents in at-risk communities have the opportunity to be vaccinated. We will continue to work with prospective employers in the days and weeks ahead in areas where workplace clinics can have the most impact to help stop the spread of COVID-19 and protect communities. We are encouraged by the news that Ontario's vaccine supply from the federal government is expected to increase dramatically in May. With the predictability of supply, we can have predictability of outcomes. There is still a long way to go.
Canada's Defence Minister Harjit Singh Sachin has announced that former Supreme Court Justice Louis Arbour will conduct an impartial inquiry into the allegations of sexual exploitation and misconduct in the military. He said that the probe would review policy processes and programs and attitudes within the military based on allegations of sexual harassment against former Army Chief Justice John Thinn.
Good morning, bonjour. I'm speaking to you from the unceded territory of the Coast Salish peoples, the Musqueam, Squamish, and Tsleil-Waututh First Nations. I want to begin today by acknowledging the anniversary of the crash of Stalker 22 off the coast of Greece. 1 year ago today, we lost 6 Canadian Armed Forces members in the line of duty. They were dedicated to their work, passionate about serving Canada, and beloved by their crew, families, and community. Our thoughts are with the families, loved ones, friends, colleagues, military families, shipmates, fellow aviators, and all Canadians who will forever feel this loss. Every day, Canadian Armed Forces members across the globe risk their lives to support our allies, partners, and friends, and to uphold values that Canadians hold dear: peace, freedom, and respect for the dignity of all people. But it is clear we have not lived up to our responsibility to protect members from misconduct. Over the past months, Canadians have heard from members affected by sexual trauma and sexual misconduct. They've shared their heart-wrenching accounts. To every member in the Canadian Armed Forces, to every person in the Department of National Defence who has been affected by sexual harassment and violence and felt that we were not there to support you, I'm truly sorry. We also know that the current reporting systems do not meet your needs. And too often, you do not feel able to report misconduct out of fear of reprisal or retribution. We have heard you, we have listened, and we are taking action. We know we must transform the culture of the defense team to one of dignity and respect.
Leader of the opposition in the House of Commons, Erin O'Toole, has targeted the federal government for talking about increased sanctions during the third movement in Canada, to which Procurement Minister Anita Nunn gave the answer.
Mr. Speaker, the third wave is devastating this country. New restrictions are in place from coast to coast. The United States of America has administered 220 million doses of vaccines. Canada has administered less than 6% of that number. The government knew that it wouldn't have enough vaccines in place to prevent a third wave. So why did it not secure the border to keep out the dangerous variants?
Honourable Minister.
Mr. Speaker, I would just like to provide some context for the numbers of doses being received in this country. 14.7 million doses received. That's 31% of Canadians who've received at least one dose, Mr. Speaker. And we are third in the G20 for cumulative doses administered. Mr. Speaker, we're going to see 2 million doses of Pfizer coming into this country in the month of May per week, and 2.5 million doses per week in the month of June. Mr. Speaker, 48 to 50 million doses will be here by the end of...
Dr. Bonnie Henry, Medical Officer of British Columbia, informed about the COVID-19 outbreaks in British Columbia. He said that the total number of positive patients in British Columbia is 108,763. He said that 800 new cases have came to light and 7 new outbreaks have been found in long-term care homes.
So for today, we don't have all of the numbers in yet, but the overall totals are in. So we do have 874 new people who've been diagnosed with COVID-19 in British Columbia, bringing our total to 128,763 people who've been diagnosed with COVID-19. That includes 187 people in the Vancouver Coastal Health Region, 574 people in the Fraser Health Region, 29 people who live in Vancouver Island Health, 60 people in Interior Health, and 24 people in the Northern Health Region. We don't have the active cases and some of the people under public health monitoring at the moment, but those will be updated on the BC CDC dashboard later this afternoon. Of the cases that we have in BC, 503 people are in hospital right now with COVID-19, 178 of whom are in critical care or ICU. We have 7 active outbreaks in long-term care, assisted living or independent living, and 6 in acute care. We've had an additional 1 death, one person who's died from COVID-19 in the last 24 hours in the Interior Health Region, bringing the total number of people in British Columbia who've died from COVID-19 to 1,577. Our condolences go again to all of the people who have lost loved ones, to their family members, to their care providers. Our thoughts are with you during these difficult times. To date, we've delivered 1,749,375 doses of all 3 of the COVID-19 vaccines in British Columbia. Of those, 90,296 are second doses.
Speaking to the media in Halifax, Trudeau said he still had a full confidence in the vaccine. A 34-year-old Montreal woman has died of a blood clot. According to health officials in Quebec, this blood clot was formed after receiving the AstraZeneca vaccine. The death is being investigated by the Public Health Agency of Canada. Trudeau said every dose of the vaccine used in Canada is considered safe by Health Canada. He also said he had full confidence in all the vaccines used here, including AstraZeneca. He had been vaccinated AstraZeneca last week and had no hesitation in doing so. So that's all we have in this edition. Stay tuned for more updated news.